Welcome back to How I AI Clinician Edition. And this week we're here with Dr. Drew Lundquist of Mankato Clinic and Nabla. So, Drew, great to have you here.
Great to be here, Sunita. Thanks for having me.
Awesome, awesome. Well, I love connecting with clinicians like you, who we've gotten to know each other over LinkedIn, which is great, and talking about AI in clinical practice. But Dr. Drew has many hats, and I think that gives him a really unique perspective of what is possible with AI. So you are Chief Medical Officer of Mankato Clinic, a successful clinic that you've been a part of for I think it's 18 years now in Minnesota. And then you are also co-founder and chief innovation officer and kind of involved in a number of different startups. And most interestingly, medical director with a very well-known startup, Nabla Scribe. So I'm really excited to kind of pick your brain as somebody who's at this intersection of clinical practice and AI.
Yeah, it's a fun spot to be. I think we were just talking that healthcare is one of the it's in an interesting spot right now. There's so much going on with technology and all of the pressures around healthcare. So I think we have to lean into those tools that we have. And AI is one of them, Novel is one of them. And I think it's a great time to be in medicine.
Awesome. Awesome. I love the optimism too. I feel that. So tell us, what are ways that you're leveraging AI in your professional life today?
I just find more and more ways to use tools. And so, it started with Nabla, and we found Nabla as a clinic before most clinics did. So about 2.5 years ago, we started piloting, and we really got on the beginning stage of that. And we've seen the use of Nabla across our clinic and across other partner clinics really grow. And with my work there, I've been able to see how that has changed from the conversations we had a year, 2 years ago, where people were scared of the AI tools that were out there.
Mm,
It's like, what about hallucinations and all that? And now they want AI to do everything in their practice. They want it to take all of their ordering, and they want it to do everything. And so it's like we almost have to slow people down now, whereas
mm.
people are kind of slow to adapt. And so, from that, I try to lean into whatever tools I can find. I use ChatGPT a fair amount just on my own, because I find that to be a tool that I can really customize on my own. And
That's
I think
great.
there's
What kind of
others.
use cases are you using ChatGPT for?
I use it for finding information on patients' conditions, right? So I
Hmm.
use it like I used to use Google,
Yeah.
and I really use that to try to find any evidence that's out there. I used to go into other tools and really try to find sources. I use that to find a source, and then I check it and go
Yeah.
back on that.
Great.
I used to use open evidence. Kind of when it first came out, I tried that, but I just found ChatGPT was more accessible for me.
Interesting. Interesting. I think that's seems to be kind of a refrain I'm hearing from a few other doctors. And is that when you think about more accessibility, is it just because you're used to kind of going to ChatGPT? It's sort of easier to navigate. Like, is there anything about it that you prefer specifically?
I think it's that habit loop.
Yeah,
It's
makes
become a
sense.
habit, and I
Yeah,
go to that for a lot of things, and I've been going to it for questions. Of course, we don't put HPI in unless it's a
yeah.
protected environment, but I think that's kind of the next step. And I think when you're trying to find things for patients, when you're a specialist, I'm a podiatrist, foot and ankle surgeon. I'm not asking generally what I perceive as general questions of it. I'm asking more specific on I want to know what's happening now. I want to know what's happening in this certain condition. So I really have a pretty nuanced question that I'm asking that I think that tool really does a good job with it.
Cool. That makes a ton of sense. That makes a ton of sense. And then tell us about some of the other tools. I was really excited to hear some of the other names you mentioned.
So I use Gamma, which is a slide creator, and it does a really, really good job. So
Nice.
those days of PowerPoints, plugging in all your slides creates things really quickly for me. And so I think I find a ton of time savings when I'm trying to create slides. I think I'm not plugging any of these companies per se, but it's one of those ones that I found myself gravitating to, and
That's great.
it's
And what do you in
it's
in
almost like, sorry, it's almost like one of those tools you kind of have I've been around a while, so it's like the Google moment.
yeah.
When I first Googled something, it's like, okay, I'm having those moments with ChatGPT, of course, a few years ago, and then things like Gamma, and now Lovable for creation of like websites and apps and things like that.
Tell us more. So tell me more. Well, first of all, just to double click on Gamma for a second. In your day-to-day as a podiatrist or working in Mankato Clinic, are you doing slides for patients? Are you doing slides for your team? Like, what's the context of your use here?
So it's not really patient care. This would be more on content creation or communicating things out to other groups
Cool.
or even creating courses. I'm creating a course on it right now. And so I
Nice.
do all the content on that, and it's just very usable. So it's not really on patient care, although I think you
Yeah.
could. I think you can
Yeah.
easily say, hey, create a bunch of slides with this content that you have for patient
Yeah.
information. I think that would be pretty cool. I just use it for other things right now.
Cool. 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 Okay, that's great. And then tell me more about Lovable too. I love hearing like doctors turn builders. Like that's super interesting.
Well,
Vibe coders rather.
yeah, vibe coder. Exactly. I didn't even know what that was until not too long ago. But really, by putting in prompts, you can create a minimally viable product of almost anything. Right. And
Yeah.
so, what I've used it for is like a patient information site, pulling research and creating an AI tool that patients can query. It does pretty interesting things on that. So, you can create
Yeah.
tools that are very specific to your condition. And it's funny because people a year from now are going to look at this conversation and it's going to be like I'm speaking about something that's well known, but it's to me, it
Right.
really kind of blew my mind of what is possible out there with some of these tools and really what's available to clinicians on communicating. I'm big on how clinicians communicate with their patients, and I think we need to meet
Mm.
them where they are. And gone are the days where patients want to come in and just hear it from their doc. Like they want to hear their specific condition based on what they have going on from their doctor, but they don't
Mm-hmm.
need all the general information on a condition, right? They're going to go
Mm-hmm.
find that. And I think we need to create those things and give them to patients. So I'm playing around with how we can do that within Lovable.
Fascinating, fascinating. So, and I love that. I think there's a few things there, like the concept of patients, coming in with a lot more information in general. So, like, how are you meeting that as a provider? But also, instead of just like generic, handouts or takeaways or things like that, like, how are you really giving patients this like super personalized sense of what's going on, what they can do. And so this like, your ability to personalize to them is just increasing with technology, it sounds like.
Well, we had talked about LinkedIn in other conversations, and I find if you put yourself out there as a clinician, most clinicians struggle to put themselves out there because they're worried about what they're going to say. Are they going to be wrong? How are patients going to perceive that? But I've found by putting out videos or putting out content that those interactions with patients are even more rich because they know how I talk. They know what I'm going to say about a condition. They kind of know how I think about things.
Mm-hmm.
And so I found that when I have patients come in the office that have seen things that I've put out there, our conversations and our interactions are so much better because it's like you cut through all the stuff of getting to know someone. It's almost like they already know me and they know how I think about things. So
Yeah.
I think when we put more conversations out there, the clinician who uses them is just going to have a much better practice than someone who doesn't.
I love that. I love that. I'm curious. It makes me think I've recently seen a demo and also been like looking into some of this for our own content creation. But, there's some really interesting implications of like avatar type communications coming out where you could create Dr. Drew and then create a follow up, very specific personalized message that's coming from you as like not just a chatbot, but, kind of more you. Do you think that's something that's interesting or creepy?
It's a little creepy, but it's
Yeah.
interesting. I think
Yeah.
yes, both because I think we need to be available to our patients, and I think
Hmm.
the traditional healthcare, like I practice in, but we're trying to kind of push those boundaries. We're going to be encroached upon by the DPC startups, the specific condition outreach clinics that do
Hmm.
something one thing really well.
Right. All of the like direct to consumer kind of things happening around
Right.
that too.
Right.
Yeah.
And so we're
Mhm.
competing with a bit of adjacent to healthcare, if I could say
Mhm.
that, which is healthcare. And so we're going to have to be able to do those things and really supercharge our practices to keep up. And I think it's a good thing because
Yeah.
because when I started practicing, we had paper charts, and that was an interesting time because you'd have to call someone to go get your patient's chart. The Pony Express would go get it, and then it would come into your office. And now, we have tools that'll go out and scrape and pull data across organizations, right? So you
Mhm.
can really get all that data and really bringing that in and pulling it into a patient conversation and a patient interaction that's going to happen within 10 to 20 minutes really quickly. I think that's the goal. That's the challenge.
That's awesome. Well, as a patient, I'm excited by where, this evolution is going to take medicine. I think as a provider, it seems like it's an exciting time to practice. So cool to be here with you, kind of building in these moments of so much new stuff coming about.
Yeah, it's an exciting time. Thanks for bringing up the
Yeah, great to have you, Dr. Drew. Thanks so much for your time. Awesome.